late 30s. She ended up getting her first implant in 2011, and she ended up getting what is a Lollipop anchor lift. And so the goal was, she had what was significant bottoming out of the implant and the capsule. So as you will see, I literally cut out what is this very heavy scar, and you can see these series of dots right here, all the way lateral. So it was essentially a scar revision, contouring, and a pseudo lift, along with a formal Lollipop anchor lift. So yes, I did do it because she had what was very compromising hypopigmented, hypertrophic scars. And as you will see, I removed that irregular, inflamed, abnormal tissue. The entirety of this done below the muscle. And so this was 100% total capsulectomy done. And as you will see, 100% of that inflamed tissue, capsular tissue, inflamed tissue removed. And this patient was very much concerned about how she's going to look, certainly just like everyone else. And this is where I revised the scars, intact implant just from 5 years ago. And as you will see, some fluid on the back. And you can see that leaching of that silicone from what is this 295, relatively small elegant implant. Here's the cut around the areola, that high scar that you can see, and then a whitened scar. All of this is a scar. And so the Lollipop anchor, and she truly ended up getting what is a Lollipop anchor lift. Lollipop anchor lift, and I cut the skin, and so it was tightening of her chest, if you will. And as you will see, complete removal of the entire implant capsule, super ultra thin capsule, as you will see right here, along with all inflamed tissue removed completely, sincerely, definitively. You can see this white band on the inside, some fatty tissue on the back, also removed because this is part of where that leaching went into. So she has only good, healthy, viable tissue remaining behind. 100% total capsulectomy. If I cut through the capsule, you will see capsule is so thin, but the tissue behind it is, as you can see, it is hard, it's inflamed and angry and not soft. So capsule will be going to pathology. So I'm going to go ahead and now remove my top glove and now focus on the left side. Again, the Lollipop anchor lift. Here's that big scar, and I cut this out. This is for contouring purposes. And as you will see right here, end block fashion, complete 100% total capsulectomy in end block fashion, inflamed tissue removed. I'm actually going to cut through this so you can see this was at the inferior aspect, and as I cut through it, you can see this is scar tissue. And so very thin capsule right here. We'll look at that in a second. I'm going to go in from here. So you can see, look at this small amount of fluid, more than what I would like, sitting on the front. You have what is a secondary capsule. She had a lot of symptoms of what is suggestive of what is breast implant illness. And so as you will see, just like you saw, you can see that stickiness, that's that leaching of the silicone. 295 elegant implant from 2020. Implant in brand new condition. And again, you will see my green glove, how thin this capsular tissue is. And you can see the band right here. She had a left capsular contracture. And all of this implant, inflamed tissue, look how saran wrap thin this is. All of this completely removed, and look at this band type of a tissue right here. All of this scar tissue removed, and so thin. Again, if I put it over the ruler, you can see how thin this is. Complete removal. End block fashion, the gold standard. No surprises. A lot of scar tissue. She had what I would say very bad scars around the nipple areola, given the lift that she had at a young age, and widened scars, as you see, hypopigmented white scars around the nipple areola, and also scars that were insensate, which means that if you touch the scar sheet, you would not have any feeling, because that's where you don't have any nerves. You don't have any blood vessels because it's scar tissue. You don't have any basically cysts, oil cysts that impart moisturizer to the skin. And so all of that scar tissue was cut out, and end result is she's going to end up getting what is that lollipop anchor lift with the contouring of her chest breast area without touching the breast tissue. Again, very important. If this is the muscle, the entire implant capsule was below the muscle. That's entirely where the capsule implant, all what was removed. The breast tissue above the muscle was not touched at all, and all what I did was scar revision that ultimately results in what is a lollipop anchor lift, because remember, it's a skin access problem. So the implants will be returned to the patient, capsules to be sent to pathology, rule out that rare BIL, CL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out any abnormal pathology, cultures for Arabic, anaerobic, and fungal, and most importantly, we'll see how the patient does physiologically, we'll see how she does aesthetically. Now, I will tell you from my practice, having done thousands of these, had she not had that lollipop anchor incision from before, that bad, horrific scar, I would not then have a lift on her, because for 295cc implants, just that pseudo lift would have sufficed. So if my purpose was scar revision and essentially at the same time giving her that lollipop anchor lift, so ultimately she had significant bottoming out of the implant and capsule, and aesthetically she's only going to do reasonably very well. This is Dr. Khan, Executive Plastic Surgery.